The winter holidays are a time to relax, celebrate, and spend time with friends and family, but it's also when respiratory viruses tend to spread more easily. The CDC says the most common illnesses during the winter months are the flu, COVID-19, and RSV. In order to prevent these viruses, the agency recommends Americans stay up to date on vaccines, practice good hygiene, take a COVID or flu test if you feel ill, and stay home to avoid putting others at risk. Sounds familiar? For more, let's bring in Dr. Peter Hotez. He's the Dean of the National School of Tropical Medicine at Baylor College of Medicine. He's also the co-director at Texas Children's Hospital Center for Vaccine Development. Doctor, it is good to see you. You told the Houston Chronicle that our levels of COVID-19 right now in the U.S. are very low, the lowest they've been since we started monitoring cases in the summer of 2020. But you also say you expect cases to go up. Look, people probably won't mask around their relatives unless someone is immunocompromised. But what about areas where we're spending a lot of time with other people, planes, trains, etc.?
Yeah, remember, and it's great to see you again. I think there's a few viruses that are out there. So COVID is at an all-time low for our pandemic, according to the wastewater numbers anyway. So that and it's backed up by hospitalization data. So that's really exciting. The bad news is we do expect it to rise again. So as we get closer towards Christmas, towards later in December, the numbers will go up. And that's also true of influenza. The influenza numbers are, the level of flu activity in the United States is fairly low right now as well, but that's going to go up. So it's going to be more as we get towards kind of the week between Christmas and New Year's. That's when things could really start to surge. The one thing that is up pretty high right now is RSV, respiratory syncytial virus. So what's the message? The message is vaccines, vaccines, and vaccines. For your COVID vaccine, if you got the annual immunization in September, you're probably going to need a booster, especially if you're at high risk in terms of age or underlying risk factors as you get into January. So that's point one. Second, if you've not gotten your flu immunization now, your annual flu vaccine, now is absolutely time to get it. And the third is, not many Americans are aware of it, but there is a new RSV vaccine that came out last year, and you want to get that as well, especially if you're older, because we have around 100,000 RSV hospitalizations a year, and around 6,000 to 10,000 RSV deaths among older Americans. So don't forget your RSV vaccine.
The U.S. is also dealing with a bird flu outbreak. How concerned should we be about that, and any precautions we should take?
Well, right now, in terms of human cases, there's no human-to-human transmission. So people are getting it working in close association with livestock, dairy cows in California and elsewhere, and also on poultry farms. There have been about 55 human cases this year of bird flu, either from poultry or cattle. So the numbers are quite low, but it's something we're watching because at some point it could really take off. And if that happens, it could be a very serious illness. So of the four, seasonal flu, COVID, RSV, your bird flu is the least of your worries right now. But talk to me again in 6 months or a year, and that could be a different situation.
Okay. Well, we hope we don't have to, but we hope you'll come back if that's the case. Dr. Peter Hotez, thank you so much.
Thank you.